This recording will go over gonorrhea. Gonorrhea is a bacterial infection that is transmitted through direct sexual contact with mucosal surfaces. The first symptom of gonorrhea may appear within a week after sexual contact with an infected person. It can present without symptoms and can be transmitted or progress without warning. In women, ascending spread of organism can cause pelvic infection, so the infection can move upward, including pelvic infection, which can include PID or pelvic inflammatory disease, endometritis, which is endometrial infection, salpingitis, which is inflammation or infection of the fallopian tubes, and pelvic peritonitis. In men, gonorrhea can cause epididymitis, which can lead to infertility if left untreated. As with any assessment for an STI, we want to establish a trusting relationship and use a non-judgmental approach when gathering information. Obtain a complete history and review the genitourinary system. Collect a sexual history. Sites of sexual exposure or intercourse should be elicited because gonorrhea can affect the genitals, rectum, and throat. Ask about allergies to antibiotics. The infection can be asymptomatic in both men and women, but women have asymptomatic or silent infections more often than men. If symptoms are present, men usually notice dysuria and penile discharge. They can be either profuse yellowish green fluid or scant clear fluid. The urethra, epididymis, seminal vesicles, and prostate can become infected. Men seek curative treatment sooner, usually because they have symptoms, and thereby avoid some of the serious complications. Women may report a change in vaginal discharge, yellow, green, profuse, odorous, urinary frequency, or dysuria. The cervix and urethra are the most common sites of infection. Anal signs and symptoms may include itching and irritation, rectal bleeding or diarrhea, and painful bowel movements. Assess the mouth for a reddened throat, ulcerated lips, tindered gums, and lesions in the throat. Fever may be a sign of an ascending infection or systemic infection. The ascending infection could be pelvic inflammatory disease in a woman or epididymitis in men. Systemic infection could include disseminated gonoccal infection. Symptoms often include joint pain of the shoulder, wrists, and lower extremities, and a rash of several days' duration. Clinical symptoms of gonorrhea can resemble those of chlamydia and need to be differentiated. Nucleic acid amplification tests are the most common type of testing for the initial microbiologic diagnosis of gonorrhea. Culture is also used when antibiotic resistance is suspected. The healthcare provider can swab the male urethra or female cervix to obtain specimens. Patient-collected urine or vaginal swabs can also be used to diagnose both gonorrhea and chlamydia infections, allowing for testing without a full examination. All patients with gonorrhea should be tested for syphilis, chlamydia, Hep B and C, and HIV, and if possible, examined for HSV and HPV because they may have been exposed to these STIs as well. Sexual partners who have been exposed in the past 30 days should be examined and specimens obtained. Uncomplicated gonorrhea is treated with antibiotics. Chlamydia infection, which is 4 times more common, is frequently found in patients with gonorrhea. Because of this, patients treated for gonorrhea should also be managed with drugs that treat chlamydial infections. Drug therapy recommended by the CDC is an IM ceftriaxone plus oral azithromycin in a single dose at the time of the initial visit with the healthcare provider, or doxycycline for a longer period of time to treat a presumed co-infection with chlamydia. Sexual partners must be educated about the infection and treated, not just evaluated, to prevent reinfection. Because the best treatment for gonorrhea is injected ceftriaxone, expedited partner therapy, where the patient takes the medicine home to the partner, is not effective. If the gonorrhea infection is left untreated, It may become disseminated, requiring hospitalization and IV or IM ceftriaxone. Teach the patients about transmission and treatment of gonorrhea. Explain that the use of medication to treat chlamydial infection at the same time is important as the likelihood of co-infection is high. Discuss the possibility of reinfection, including the risk for pelvic inflammatory disease or PID. Instruct patients to restrain from sexual activity until the antibiotic therapy is completed and they no longer have symptoms. Reinforce the need for condoms at all time and explain that gonorrhea is a reportable disease. Make sure to discuss the patient's feelings, as they often have feelings of fear or guilt. Encourage patients to express their feelings and offer other information and professional resources to help them understand their diagnosis and treatment. Make sure to ensure privacy and maintain confidentiality.